Hi, I'm Meshal Malik and you're watching Indus Special. Every year on the 5th of February, Pakistanis and Kashmiris across the world observe Kashmir Solidarity Day. While no one can truly feel the lived reality of over 8 million Kashmiris in the region, the purpose of this day is to remember the lives that have been lost and impacted due to oppression, and to realize the oppression continues to this day. As we again mark Kashmir Day this year, we also mark the 6th month since the valley of Jammu and Kashmir has been under a complete lockdown. On the 5th of August 2019, India revoked Kashmir's special status and annexed the land while putting the people of the valley under a blanket curfew. As days pass by since the lockdown, the world continues to turn, but the lives of the Kashmiris remain to stand still. On today's show, we take a deeper look at the lives of millions of people in occupation. We are joined by Mr. Nazir Shawl, who's a Kashmiri and the chairman of Kashmir Concern. He joins us from London. Also joining us out of Srinagar today is Mr. Mir Jawahar, who's an activist, and Mr. Abubakr Molla, who's an international law expert, joining us from London. Thank you all for joining us and welcome to the show. Mr. Jawahar, I'd like to begin by you. Now, you're, of course, there in the valley. You can give us a better sense than anyone of what has been happening since the past 6 months, and especially how the mood is today.
The life is actually here. It's a different. Okay, what people in the other parts of the world live, the life here is different, totally different. So since 6th of August, there has been a continuous lockdown, and we are living in, I can tell you that it's a prison-like situation where we have been living, okay? And since 5th of August, when the special status was scrapped, that was taken away, so it has gone worse.
And when you say it's gone worse, now we have been in contact with many Kashmiris, many who fear for their lives to come on television, many who aren't able to come on television or talk to us freely. But they do say this one thing, that life in Kashmir before, when it was occupied by India, was turbulent. There was violence, there was conflict. But now after it, there does seem to be a noticeable change. Can you expand on that more? What do the people on ground feel after the 5th of August?
Hey, the people on the ground, okay, they are actually very fearful. There's a panic, okay, so no one dares to speak up, okay. They know if people speak up, on the next moment they will find themselves behind the bars. Okay, this is the situation over here. You don't have any right to express. So the world's largest democracy, so-called democracy, okay? So they don't bother about the basic fundamental rights, which are enshrined not by the world community, but by their constitution as well. The basic fundamental rights, the right to express yourself, okay? So you can see even today, tens and thousands of people over here, they are just behind the bars.
Mr. Jawahar, you're saying, and this is something that is being reported, this is something that has come to become an unfortunate fact, that it is an open-air prison. Tell us about the day-to-day happenings when it comes to traveling, trying to get medical help, children trying to go to school. How has the life been impacted at a very fundamental level?
Schools have been off, okay, since 5th of Feb, okay, the day this unfortunate deed was done, okay, the schools have been off since then, okay.
What about the reports that we hear that there is a high attendance in classrooms? Now, Mr. Amit Shah from India also stated that there is high attendance rates. What do we make out of that when you're saying that schools have been closed?
That is a blatant lie. Okay, what you can if you're true in your statements, then why don't you allow? Okay, why don't you allow the media over here? Why there's a curb on it? Okay, the local media. Why the international activists who want to come over here? Why don't you allow them? If you're true in your statements.
Yes. And this is the state of the schools that you have briefed us on. We would also like to know more insight into the conditions of the hospitals, especially patients who have been suffering, haven't been able to access the medical care they desperately need.
No, that is everything. Whenever there's a lockdown, okay, there's a curfew-like situation, okay. So everything comes to a standstill. It's not about education only. It's about health as well. It's about all basic amenities, okay? So everything comes to standstill. And that is the situation over here.
Right. And that, of course, is one situation that, as you've stated, does not be shown to the world, but it is the reality of the 8 million people living inside the valley. Thank you so much, Mr. Mir Jawahar, for taking out the time and talking to us today on Indus Special. Mr. Nazir Ahmed Shawl, now you're hearing what has been reported from the ground. This, of course, seems to be a disconnect with what the Indian government is stating and what the world is being told. How are you, as a Kashmiri living abroad, and other fellow Kashmiris trying to bring light to this case continuously as days go by with the curfew still being upheld?
Thank you, Meshal, for taking me online. Today is Solidarity Day, and in fact, this day is an expression of the people of Pakistan, the government of Pakistan, political and military leadership of Pakistan, of support to the people of Jammu and Kashmir, who are suffering the worst possible human rights violations. And in fact, I would say that a genocidal campaign is on in Kashmir, and what is needed is to expose this phase of Indian democracy. And in fact, we find that India, under the present fascist regime, is changing, and it has created a lot of problems, not only for the people of Jammu and Kashmir, but for all the minorities that are living in length and breadth of India. And in fact, as has been said earlier, and I fully endorse what has been said. In the light of all these happenings, what is needed is effective diplomatic endeavor in international institutions, in intergovernmental institutions, and I must say that the things are moving, and the diaspora after 5th August has spontaneously responded to these sufferings, and they have raised their voice. And this voice has been raised not only in the United Kingdom, in the United States, in Canada, in different parts, in Europe, in different parts of the world. And as a consequence of this strong voice, what has happened is that the media, the world media, has reported the sufferings. Although there is a cyber curfew in Kashmir, but still the trickle that is coming out through some people who believe in a sane approach to human suffering. This has been reported.
Mr. Shawl, stay with me on that. That is an essential point about the stories and the reports that have been coming out, trickling out of Indian-occupied Kashmir. But before that, I want to jump to Mr. Abubakr Molla and talk to him about something that Mr. Shawl raised here, which was a genocidal campaign. Now, in the international framework, legal framework, what can a person understand by genocide? What does it entail?
Thank you very much for asking me about the genocide. We have heard the report. If those are facts, if those are proven, there are credible cases of genocide against the perpetrators. So what are genocides? So genocides consists of five big crimes. It is dealt with Article 6 of International Criminal Code. And also there is another crimes named crimes against humanity. Some of the crimes are common between some articles of the International Criminal Code. But however, according to the report, what we have seen in the international media and what we have heard today, some of the crimes definitely falls under the definition of genocide and the crimes against humanity. The problem at the moment is, and not only that, there is a crime of apartheid regime. And if what we have heard, that those are facts, then there can be a case against the perpetrators, whoever has done that, in the International Criminal Code based in Netherlands.
Right, Mr. Molla, now we're going to talk about the mechanism that exists to address this, but Mr. Nazir, Ahmed, Shawl, going to that point about whether and how this can be confirmed. Now, Mr. Mir Jawahar pointed this, that if there is nothing going on, if there's nothing to be scared of to show the world, international media outlets should be allowed to monitor the situation on ground in Jammu and Kashmir. Foreign bodies should be allowed to monitor the situation in Jammu and Kashmir. But that seems like it's not a possibility, at least not in the distant future. With all of this, how can we tell with the situation that has even prevailed previously to August 5th that there have been grave human rights violations within Kashmir?
What is being said about the genocide, and there are reports. There are two reports that were presented to the United Nations Human Rights Council. One is the July 2018 report, and another is July 2019 report, and both the reports have reported gross human rights violations in Indian occupied Kashmir, and there are other international human rights groups who have also accused Indian armed forces, military and paramilitary, and J&K police force of using excessive force that has led to unlawful killings. And if we go by what is written in 1948 Convention of the crime of genocide, we can find that there are four important elements that need to be considered while we are talking about genocide. One is killing the members of the group. One thing is to be recognized that Kashmiris as a whole or part are a national, ethical, racial, and a religious group. So this group has been continuously under this genocidal campaign right from 1989. And so far, around 95,475 killings since January 1989 to December 2019 have been reported, and this is a corroborated argument that there is a systematic pattern to place with intent to destroy in whole or in part the Kashmiris. Therefore, there are evidences, and this is a fit case to be presented to either ICJ or to the International Criminal Court. So there are other elements also. For example, causing serious bodily or mental harm to the members of the group. And the pellet guns that have been used, those pellet guns have harmed thousands of people, and most of the people have lost their eyesight. This also comes in the
excessive force.
If we yeah.
Right. This also included in the category of using excessive force. Mr. Abubakr, Molla, now, as Mr. Shawl stated, there have been two reports released by the United Nations that have concluded that there is use of excessive force. There is use of the Public Safety Act, which is detention up to 2 years without charge. There are many other things, forceful disappearances, including which inflicts mental health implications, which causes much distress, which also is included in the Convention Against Genocide. Now, given this is a very strong case. When we go and talk about the international mechanisms available to address this, take us through that.
Thank you very much. We have heard from Mr. Nazir, and we have seen the reports of international media, and I have personally seen the reports which was submitted and which was approved in the United Nations Human Rights Council. I have seen both of the reports. So it is clear there are clear violations of Geneva Conventions. But now the case to be brought to International Criminal Court or International Court of Justice. But in the International Court of Justice, the perpetrators cannot be tried. There is no mechanism by the International Court of Justice to try and punish someone who has committed the crime. So only mechanism available, only platform available is the International Criminal Court. But very unfortunately, neither India nor Pakistan are not the member of International Criminal Court. Either Pakistan should ratify the International Criminal Court, or Pakistan can raise the matter to International Court of Justice. But for the sake of proper and total justice, and the crimes committed to the Kashmiri people, I think that if Pakistan would have ratified the International Criminal Court, which is the Rome Statute, then I believe, according to the human rights report which was published and for which India has been condemned twice, a successful case can be brought and justice can be served. I think that is the only way forward. That those who are very concerned, they should ask Pakistani government to ratify the Rome Statute and be a member of International Criminal Court. And I believe a successful criminal case can be brought.
Right, Mr. Shawl, now, Mr. Jawahar, forth one way that this can be brought to light, but also discussing the fact that after the 5th of August, after 50 years, Kashmir was high up on the agenda in the United Nations Security Council. There was a momentum that was built. The only thing that was seen to work in favor of the Kashmiri people was that this issue was finally getting its due notice. Do you feel like with the time that's passed by now, today marks the 185th day of the lockdown, the international community is becoming more soft on the issue?
I think the Kashmiri people have become victims of geopolitics at different points of time. You know, when Kashmir was high on the agenda in early 60s, and a veto destroyed the further proceedings. A plebiscite administrator was also was appointed, but he couldn't hold the office because of the geopolitics and because of the Cold War that was going on. And similarly, after 9/11, all the international self-determination movements were brought in the gambit of terrorism, whereas self-determination and terrorism are two different things. And Kashmiris are fighting a genuine struggle for their self-determination. Similarly, the economic power of the countries has also been one of the considerations at the international global level that has affected the conflict situations in different regions. And Kashmir has also been a victim of this self-enlightened interest of the powerful nations. But I feel the world at present is trying to see Kashmir through the prism of a different through a different prism, and the prism is that both India and Pakistan are nuclear powers, and Kashmir is a flashpoint. So this is a matter of great concern to the international community.
Mr. Nazir, you rightly state that Kashmir, as it has always been, is a nuclear flashpoint between two nuclear states. That requires a great amount of urgency. We don't seem to be seeing that. We talk about the 8 million people being held captive, being held hostage by the Indian state, a state that proclaims it's a democracy. We also see the threat there, but we are not seeing enough momentum to meet it. What way do you think is the way forward to actually get that attention, get that momentum built up again?
I think today in the AJK Assembly, Prime Minister Imran Khan has rightly pointed out that we need to bring to the world the dangers of the fascist dispensation which is saddled in New Delhi. We need to tell the world that Hindutva is not only threatening a catastrophe in this part of the world, but it is a way Hitler. It is a way we have seen a lot of suffering under the fascist regime of Hitler, and in fact, Modi, Amit Shah, and Dole are trying to become the modern Hitlers, and this aspect of the Indian society, this reality, this political reality, needs to be transformed into a diplomatic initiative, and this needs to be brought in the limelight of the world, and the world needs to know that a great catastrophe is coming up in this part of the region, and it needs to be prevented. And that is the only way we can just arouse a conscious approach.
Right. Mr. Abubakr, Molla, I'm going to take this question to you following from what Mr. Shawl is talking about. There has been a parallel being drawn, of course, by the Prime Minister of Pakistan, but also all around the world, that what is happening in India is, of course, ethnic cleansing on many parts. What's happening in Kashmir is repression of Muslims leading to ethnic cleansing. The revocation of Article 370 is leading to that conclusion. Now, when we hear India claim that it is one of the largest democracies in the world, how do you see that being incompatible with the human rights that are enshrined in the international constitution and the international laws, which are supposed to protect civilians from these very grave violations?
First of all, the claiming by India that they are the largest democracy, they can claim whatever they want to claim. But the fact of the matter is whether they are protecting the fundamental rights given by the democracy. So if they are not protecting the fundamental rights in a democracy, they are not a true democracy. This is one thing. But another thing is that, as I mentioned previously, there are credible reports of crimes against humanity and genocide committed by the perpetrators on the side of India. And you have already hinted about the international community's a bit reluctance what is going on in India. You know that if you go through the avenue of Security Council, it may not happen because there are a lot of diplomatic the mechanism going on that there. We have seen the last United Nations Security Council meeting, and there has not been any fruit from that meeting. So I believe that United Nations Security Council will not come forward for stopping genocide or the crimes against humanity. It is very clear that crimes against humanity is being committed and the genocide is being committed. And in Pakistan, what India is doing, at least in particular in Kashmir, it is nothing but an apartheid regime. As it is very clear, but international community seem to be reluctant.
Molla, we're going to wrap up the conversation here, but thank you so much for your time and for giving us your insight into the legal perspective of this. Thank you, Mr. Nazir and Shawl, for joining us from London and giving your valuable insight into this. We're going to go for a short break. When we return, we take a look at the latest developments surrounding the new Wuhan coronavirus. Stay with us. Welcome back to the show. We've been covering the new coronavirus and the developments as they take place. As of today, the death toll has passed 490 and the virus has been confirmed in 26 countries. The World Health Organization last week also declared the virus as a global health emergency, which of course is a signal to countries all over the world to prepare for the virus. Let's discuss this story further. Joining us now is Mr. Amesh, who's a doctor and a senior scholar at the Johns Hopkins University Center for Health Security. His work is focused on emerging infectious diseases, pandemic preparedness, and biosecurity. He joins us from New York. Also joining us is Mr. Einar Tangen, who is an analyst joining us from Beijing. Thank you both for joining us and welcome to the show. Mr. Tangen, now since you are, of course, talking to us out of Beijing at the moment, could you tell us about the on-ground situation?
Actually, the on-the-ground situation is not what the international hype is. People are actually, taking precautions. Very few people on the street. A lot of messages going back and forth to people, encouraging them to be safe, stay away from crowds. Within the buildings themselves, they have very stringent measures. Guests heavily discouraged. Deliverymen cannot come into the different compounds. They're wiping down the different areas with bleach twice a day, and then areas which are often used, especially hand areas like door handles and elevator buttons are being wiped down every 30 minutes. They're even putting plastic guard on top of them. So, the government has taken a very constructive response. People seem to appreciate it. There are always some people out there who are being swayed by a lot of social media action that's claiming all sorts of very bizarre, false facts. But right now, if you actually were on the streets of Beijing, you'd see that it's very, very calm.
Right, Mr. Tangen, since you've brought this up, I think this is important to discuss as well, the misinformation that is circulating online and, of course, in the mainstream media. What can you tell us more about that, how it's different from the on-ground situation?
Well, I mean, there's all sorts of bizarre theories that are floating around that this is somehow instigated by the CIA or this can only affect Chinese people. And it's kind of degenerated into kind of a racist issue. You have people standing up and leaving if they see a Chinese person. There have been numerous things written on social media that, this is China's fault. Now, it's very strange because in actuality, this is something that's shown itself to have, in comparison, a fairly low mortality. It's about twice as dangerous as the common flu, but nowhere near as dangerous as any of the flus that, the big flus that have gone before it, like SARS, avian, swine flu. In the case of swine flu, it's interesting that this started in the U.S., yet there was no one said, oh, this is a U.S. disease and created by them. So in China, there's this feeling that somehow, perhaps, for instance, the U.S. is trying to, put more pressure on them by making this a PR issue. And unfortunately, this is going to have long-term consequences. People are going to remember this. And it's going to be very, very hard for them to swallow. I think it's another part of it.
We're going to talk more about the long-term consequences. And of course, as you've mentioned, on social media and the mainstream media, there are strong undertones of racism that are involved when discussing this issue. Of course, it's important during times like this when lives are at stake to be as careful and report it as cautiously as possible. Mr. Adalja, now, on the point of this being a health emergency, the World Health Organization did declare that this, in fact, is a health emergency, but they also have stated earlier today that it is not a pandemic just as of yet. What is the difference between these two?
To me, I really think that we are in the early stages of a mild pandemic. We have this in more than 24 countries. We have sustained human-to-human spread, and for all intents and purposes, this is a pandemic. This is not something that's going to be contained in one country. Based on the fact that we know that this has the ability to transmit efficiently from humans, we have to prepare the world for cases to occur in their communities. It may not be a severe pandemic, but it will be one that is disruptive and may stress healthcare systems throughout the world.
Why do you think that the World Health Organization is taking a very different approach to this? At first, when people thought that this would be declared as a World Health Emergency, many people speculated that it should be. The Chinese media was also reporting the severity of it. They stayed back, prevented from calling it one. And now they're saying that it's not a pandemic, but experts such as yourself are saying that this is, in fact, an early stage of a pandemic. Why do you see this difference?
There are still some open questions and some open debate whether or not this virus can be contained. I don't believe it can be contained based on the fact that it's a respiratory virus, and we know that coronaviruses can spread within communities. But it is a debate that's going on, and there are a lot of questions about what the spread will look like. However, I think there's enough information now to really move from containment to more mitigation and trying to prepare countries for an onslaught of cases that they may get when it arrives in their area, if it hasn't already arrived there.
Right. And I want to get your take on the mitigation aspect of this. But before that, I'm going to jump back to Mr. Einar Tangen and talk to him about this. As the death toll and the numbers of infections rise by the hour, one can argue, how more aggressive has the policy and the approach of the Chinese authority become in just the last couple of days, this week beginning?
Well, you saw Xi Jinping actually go on TV and say that more has to be done and that efforts will be redoubled, that they will do everything in their power to do it. And I think they are. I mean, I would agree with my colleague. This is what you would term a mild epidemic or pandemic if it reaches that proportions. So it's important to understand what it is and to prevent this kind of just speculation, fear, driving, racism, and all of these types of things. The misinformation is really what is hurting things here. It's causing people to flee China, and when if there are not precautions taken when they go back, remember they'll be on an airplane. If many people didn't have it before they were on the airplane, it's possible that they could get it while they're on there. It's a respiratory; it spreads easily. And that's really the danger here. Now, the biggest issue here is making sure that this virus does not get transmitted to those who are at risk. Infants below 2 years old, people who are in their upper 60s, anybody who has had any kind of impairment to their immune system, whether that's it could be diabetes, it could be cancer treatments, et cetera, et cetera. So this is what's really driving a lot of this, is not so much that it's going to hurt the majority of people, but that it can be transmitted to people at risk.
Right. Mr. Amesh, Adalja, now this is a point, of course, when we had a conversation with you earlier, you brought up and you said that the evacuations may not be a bad thing. Now, when you're hearing Mr. Einar Tangen put it this way, that it's going to put more people vulnerable to contracting this disease, do you change your opinion at all?
No, I think that there are issues. The evacuation wasn't necessarily because I was afraid of people getting the infection. I think that it was just the conditions there were becoming something that we were trying to limit our exposure to, in terms of the fact that you had 50 million people quarantined and there were shortages there and there was a lot of panic going on. So I don't think that, while I don't think that travel bans and travel restrictions make any sense, I think that if people wanted to leave the 50 million quarantine zone, I do think that was appropriate and should have been permitted. And I didn't have any issue with the United States and other countries evacuating their citizens out of that area. But I do not believe that area should be under quarantine. I think that was an overreaction and made things worse there and actually increased the panic.
But didn't you just earlier say that this is in earlier stages of a pandemic? So what does one do if this seems to be this severe and they don't quarantine people?
It's a respiratory spread virus. These quarantines are not going to work. The travel ban in the United States is not going to prevent this from coming to the United States. This is a mild pandemic. We have to really focus on finding cases and actually preparing our healthcare system for it. It's not, travel bans don't work, quarantines don't work. This respiratory viruses will spread despite these types of efforts. And this is what happened during 2009, during the H1N1 pandemic, which began not in the United States, as your guest said, but in Mexico. And we know that travel bans, including one at that point that China did, where they banned flights between Tijuana and Shanghai, those don't work. That didn't stop it from coming to China, and it's not going to stop this from coming to the United States.
Mr. Adalja, I just want to press this a little more. Now, you're saying that the need of the hour is to beef up your healthcare infrastructure to find long-term solutions. But that is what they are, long-term solutions. When something is spreading so fast and the nature of the virus is unknown, do you still think that it's fine for people to travel from one place to the other when it's still at the risk of not even knowing what this virus entails?
We do know what this virus entails. We know it's a coronavirus. We understand where it fits. We know that it's much less severe than SARS. We know it's spreading from the respiratory route. And it's not a question of trying to make people feel safe from this virus. The fact is it's going to spread. It is a respiratory spread virus. We know that these are almost nearly impossible to interrupt their transmission. So I do think that this is just this isn't really a warranted action, and it's actually diverting resources away from what we need to do, which is step up surveillance in our communities. We need to get our healthcare systems able to deal with this. We need to look at our supply chains. We need to accelerate vaccine development, set up antiviral trials. There are things that need to be done.
Mr. Adalja, stay with me. I want to jump Mr. Einar Tangen and talk to him about the points that you raised. Mr. Einar Tangen, what is your take on all of this?
Okay. Well, in terms of Mexico, he's right. That's where the first patients started contracting it. But as he also knows, there's a number of different strains that went in there where we're involved in that. And this is what's so dangerous. With these kinds of viruses, you can just say it's a coronavirus, but it actually seems to have more than one component. And unfortunately, what can result is you have one person passing it to 6 different people, but they are showing different levels of response and different levels of virus. So it is going to spread if you do not take action. I don't think that any government could realistically say they're going to do nothing because it's just okay. I understand the argument about concentrating resources on treatment. That's fine as far as it goes, but you have to try to make sure that you're not transmitting it to a large proportion of the population. I mean, the people who get sick, young people and elderly people, are not statistics. These are people who, they're the children, grandparents, and parents of people who are living now. So you can't just be cavalier and say, oh, don't worry about it.
Right, Mr. Einar Tangen, but I want to raise a point that Mr. Adalja raised, and that many people have a concern about, which is the quarantine that many people are in within many areas of China. Now, this has raised concerns of inaccess to medical health care, to many other things such as food. Can you tell us more about that? Is it actually as bad as it's being reported? People can't get access to food. They can't get access to even healthcare services because there's such a blockade of getting to those places.
All right. First, let's deal with the food. The reason there is an actual shortage of surgical masks and also alcohol and anything, hand sanitizer, things like that. In terms of food, no. What's driving the shortages right now is panic buying. People are running out and just grabbing everything on a shelf, and that's not helpful. And that's being spread by these social media rumors that are going on constantly. In terms of the second question, yes, hospitals are not equipped to handle normally this kind of huge incident. So you're not going to have enough hospital beds and things like that. It's also very difficult. People become very paranoid. If they catch a cold, they wonder if they have the virus. If they have a regular flu, they wonder if they have the virus. Plus, you have all the regular medical things that are going on with people as they go through life. So you're having to try to treat everybody that you would normally treat, plus these additional ones.
Mr. Adalja, just a short question to you before I have to go back to Mr. Adalja and we have to come to concluding the show. Now, you're saying that there is, of course, a lot of panic which is being driven by social media, but there in China, of course, the Chinese government has a greater control over the internet than most countries do. How is the government taking an effort to dispel this misinformation?
Well, I mean, they have aggressively gone against any kind of rumors. And more importantly, they've been very transparent in communicating exactly what's happening. It's not just having false information. You have to have a source of good information. And I think China, according to the WTO and most scientific bodies, would say that has actually created a gold standard for this. There seems to be a lot of sniping, a lot of anti-China rhetoric out there, not only on social media, but in the international media. The number of what I would say irresponsible journalistic journalistic.
Right, Mr. Tangen, we're going to unfortunately, sorry to interrupt you, but I just want to get a quick word from Mr. Adalja since we're running short on time. Mr. Adalja, how far have we come? How far is the global scientific community on trying to find a long-term solution, which is a vaccine to this issue?
What we're seeing is a rapid scale-up of many different approaches to vaccines that are all being funded and all being supported. It's going to be still some time before we actually begin phase 1 trials on these vaccines, a matter of months, and it will likely be over a year before we actually have a commercially viable vaccine in enough quantity to be able to vaccinate those that are at risk. But it is important. It's an important task that we need to do, and this is accelerated. But it's still not going to end this outbreak. This outbreak is going.
Right. So till that 1 year mark, you're saying when it can be a commercially viable vaccine. Till then, what are some of the precautions? What are some of the ways in which patients are being dealt with? And we're hearing a lot about recovery cases. What's being done there?
It's usually just going to be supportive care, IV fluids, oxygen, and getting the people through the illness. There are some experimental antivirals that are being used. We used one in one of our cases in the United States here. Those will be scaled up. They'll do clinical trials to see if they're effective in those patients who are most severe. But again, remember, most cases are going to be mild and not require very much in terms of treatment. It's just going to be watching them and monitoring them.
Right. Till next time, thank you so much, Mr. Amesh joining us from New York, Mr. Einar Tangen for taking out the time and talking to us from Beijing. It was lovely talking to you both and getting an update on this issue, which we will continue to cover as developments come in. Thank you for watching Indus Special. We will see you again next week. Till then, goodbye and take care.